Well, Meet the Buyers 2012 is the third Meet the Buyers event that SEHTA's put on. And for me this is very exciting because today we have more service providers in the room rather than technology providers. And given that this market in telehealth and assisted living is much more about service provision in my view, it means that we're on the cusp, I think, of a real commercial opportunity, especially as some of these people here are actually starting to make money.
We call ourselves the International Centre of Excellence. We have got delegates from Italy, Finland, Turkey, France, New Zealand, Spain, Scandinavia and the Netherlands.
We're an organisation that was created about 6 years ago to provide that understanding and interface with industry. And we've developed our remit really to put ourselves at the heart of academics, business and care and clinicians. So we operate at that interface between the three.
SEHTA's work in the area of telecare and telehealth is to help companies in the southeast to develop the new products and services that are needed, but equally to work with the NHS and the statutory sector generally to help them articulate exactly what they need by way of remote monitoring and remote service delivery.
It's interesting that 90% of all interactions in healthcare are face-to-face, and even a 1% reduction in that would save up to £200 million, and that's for 2012 figures. So for us in particular, we could have good quality interaction with our patients. There would be huge savings, and that would allow us, we hope, to see more patients and to move away from just fixing things that are broken to actually move into more preventative care.
If we just focus on the right for a moment in terms of technology push, 2025 we've got 1 million sufferers from dementia, going up from just over 500,000 today. So the issues in this area are only going to increase. Dementia costs the UK of 17 billion per year, or £25,000 per person. That's a current cost at the moment. So it's a significant cost to our society.
Currently we have around 1,300 members from 20 different countries. And today is a very good example of how we bring together companies, individuals and organisations from a range of countries, all coming together to share their experiences, share their opportunities. So we genuinely try and spread our remit internationally.
Primary prevention, it doesn't just involve lifestyle, it involves better housing, trying to reduce health inequalities, increasing access to services. So there's a broad public health agenda. Primary prevention is trying to stop people becoming sick in the first place. Secondary prevention, people with conditions, reducing the probability they develop complications or have exacerbations. 75% of deaths in the UK for conditions, and they share 4 common behavioural risk factors: poor diet, physical activity, inactivity, harmful use of alcohol and tobacco use. So it's not just what you take, it's what you do. And people need help. People need help changing their behaviour.
The National Spinal Injuries Centre is one of the global assets we have in the district. It is a centre for innovation, for clinical excellence, working with the spinal injuries patient group. We want to bring inward investment and businesses to collaborate around research projects and ultimately to settle here to provide jobs for future, high-level jobs. Our role is to facilitate that with partners and make that happen.
And so that whole thing about when you're designing technology, when you're creating things to enable living, what is possible, actually is that limiting your belief of what someone could do. And no one got involved and interfered with going, yeah, but you've got to have room for your winter coat, which was wheelchair number 1. And I think wheelchair number 3, they went, oh, you know, that might be a bit narrow. This chair hugs me. It's not dangerous, but that ability to know what's best for you. I have way less back problems. I don't sit on a pressure relieving cushion because that causes scoliosis. The ability to take control, work with someone and say, how am I going to create something? This is performance technology, but this is performance for day-to-day life. I don't need to see my physio as often. It didn't cost any different than the last chair. It's just I was able to take control.
This has been our biggest and our best Meet the Buyers. We've had over 100 companies here. We've had about 150 delegates, 10 top-class speakers. But really what Meet the Buyers is about is providing an opportunity for those with innovative new products and services and assistive technologies to meet potential buyers of those services. And we've had 200-300 meetings, face-to-face meetings of buyers and sellers, and we know that deals will be done as a result of our efforts today.